Hello everyone, this is Arj Errol and you're watching Health Podcast brought to you by Health Checks 360. Have you ever thought एक दिन मैं भी CEO बनूंगी? Have you ever thought?
Got into the journey of introducing preventive healthcare in UAE, and that's where we are today.
13 years of journey of Health Checks 360. What was the reaction by your family that when you said that I want to study dentist, I want to become a dentist? क्या reaction था?
So nobody gives you a call in the middle of the night, I've got a toothache and you need to open your clinic. We've been the driver, we've been the collection guys, we've been the courier guy, every role that was there, the administration, the shipping.
Because now the talking to ourselves called as a manifestation. The 18 age is a very tricky age. People start dreaming at that age. People think that okay, मैं बड़ी हो गई and all. Are you proud of yourself? What's next? What's your vision now? And do you have any plans in pipeline that in 2 years until you feel something? They never used to visit hospital. Now at least people go to gym. People are spending time on healthcare, well-being.
Let me tell you, dentists are the worst patients if you see.
Explain. This is one tricky question. Does people take time to smile in front of you? Today we have Dr. Naushin. Dr. Naushin, welcome to the show.
Hello, good morning.
How are you?
I'm fine. How are you doing, Arun?
I'm doing great, and it is very nice to meet you and hear your story. Before that, I'd like to ask, where are you from, and what was your dream, ambition while you growing up?
Okay, so I'm a dentist by profession, and I'm basically from Mumbai. I did my studies in Mumbai, and it was only in 2011 that I moved to UAE. Before that, I had my own dental practice in Mumbai, where I really did a lot of clinical hands-on work on my patients' treatments. The most that I enjoyed was connecting and uh, sharing ideas, thoughts with my patients.
Okay, while growing up, have you ever thought you will become the CEO of Health Checks 360? Have you ever thought एक दिन मैं भी CEO बनूंगी? Have you ever thought?
See, frankly, when I was studying or I was pursuing my education in dentistry, there was no such plan of coming to UAE also as well. As I mentioned, I had my own clinic, so there was no vision of becoming a CEO or something. But if I had to connect it to why it happened is because dentistry itself is a profession, like you are thinking of prevention right from the beginning. The moment the customer comes into your clinic, the patient, you are always thinking of prophylaxis. You're thinking how you can prevent the next decay, or how you could help him treat his take care of his oral hygiene. And when I came here, I met Joseph. He already had this vision of doing something about preventive care, introducing prevention into the UAE market. There was no such concept at that time. People were doing investigations or tests only when they were sick. They used to visit doctors only when they required something, the body demanded something. Otherwise, there was no such prevention concept earlier. And when I met him, immediately that I could say that the ideas or the thoughts, they link together. His vision and my core principles that I learned during my training of dentistry, as I mentioned, they both linked together and they gelled in. And throughout that, we got into the journey of introducing preventive healthcare in UAE, and that's where we are today.
Wow. Definitely, we're going to discuss 13 years of journey of Health Checks 360 in some time. Before that, I would like to ask one question. What was the reaction by your family that when you said that I want to study dentist, I want to become a dentist? क्या reaction था?
Okay. So basically, I come from a family where my father itself is a medico. He's been practicing for past many years. He's still practicing, and so I grew up with that in that environment that where education was considered important, and I had my own free choice to choose what I would want to pursue in. And that's the time where I decided more than MBBS, I chose BDS because it was more of skill work. I am a creative person, so I like to explore my hands on with the work that I do. So yes, that put me into dentistry. Plus, also like as being a lady, that was another thought flow that had that I had at that time was there are no medical emergencies in the middle of the night.
Oh.
So as a family lady, you see,
Mhm.
that was a concept that I had because I used to see my father getting patients coming up at home in the middle of night as well. So being a lady, I felt that a little privacy for my family life.
This is one tricky question. Does people take time to smile in front of you?
No, I think I make them comfortable. Did you feel so?
No, you because a lot of us are not so comfortable to smile and open their mouth in front of a dentist.
Absolutely. Let me tell you, dentists are the worst patients if you see.
Explain.
Because the dentist knows what the other dentist is gonna do in his mouth.
Oh, okay.
They know what the pain is gonna be like, and they'll be fussy about asking more questions. What are you doing next? What has happened? And you can't see your own tooth, so
Ah.
so they'll react in their own ways.
Remember some of the memorable moments of your career. Three memorable moments, if you could tell us.
I think all patients have left some valuable memory, or they've been played a very important part in the journey all throughout. We've been handling patients actually right from our college journey. It's not just after I pass out. So even during that phase, I've got some patients who, uh, they used to come because in the college time also, they we were interns, we were learning, we were just experimenting hands on on the patients. But I did have a patient who used to come only looking out for me, and
Oh,
that used to give me so much of confidence at that time, because you're still studying, and someone looking out for you and say no, I thought tum beta kab aane wale ho, like when is your posting in this department, like I would
so
come.
nice.
So those kind of things actually give you a boost, like that you're really doing something good, you're making people feel better. So that's one thing that got me into my um, that confidence carried into my career as well, into my own practice as well. And during my clinic also, I had good patients who have been supportive, who have been really kind, really leaving an impact to me, rather than with their own gestures, the way, the respect, the love that they shared. I mean, it had been a wonderful journey that way.
The kindness is the most important role in your journey. Yeah, okay.
Absolutely.
Now, Health Checks 360.
Yes.
You completed 13 years.
Yes.
Congratulations. And you're
Thank
the
you.
CEO of this
Thank you.
company.
Thank
So, how did it started? Like, if you could cherish the first day of in your office at your
First day,
office.
yes. So actually, Joseph is the one who had this vision of introducing preventive
If you could,
healthcare.
if you tell more about Joseph, who
Yeah,
is he?
Joseph is a
Yeah.
founder of HX 360. He's been actually, he's not with us here right now, but he's quite visionary in terms of what he wanted. And if I have to give you a background of why he started it, it would be his visit to India, where really experiences firsthand of how that one checkup that he took on a preventive basis
Oh,
helped him to identify things that were underlying in his body. He didn't know them.
okay.
Okay. And that triggered him that, okay, prevention is such a good thing, why aren't people doing it? Why is it not something that people keep at priority? Why is health something that people will only attend to when they fall sick? That's how it all started with him. And I was the first, you know, I was there with him from the first day, you can say. And at that point, we had nothing but just an idea and the conviction that we are going to do something good. We're trying to introduce preventive healthcare. We're trying to make a proactive, a pro health society. But there was no playbook, no template, no rules, nothing. Just that thought that yes, we have to give something good to the society. And it's been 13 years now. You see, there are so many clinics that have turned into this preventive mode now. Earlier there was no concept, and it slowly has evolved. I think maybe we've been the first one to introduce that.
Oh, okay.
You know, doctors were actually, every doctor would say prevention is better than cure, but nobody was actually promoting prevention.
Okay.
And they were not wrong, you know, because the concept that time was such that, you know, there were two reasons basically why this was happening. Was firstly, the people were not ready. Customers who didn't want prevention, they were not ready to spend on preventive health screenings. And secondly, those clinics which had preventive health packages were so highly priced that, you know, there was a hesitancy between both the clinic and the patients
And
to
also,
really
most
go
of the
for.
insurance doesn't cover dentistry
Yes,
as
yes,
well.
yes, yes.
Yeah.
Not just dentistry. I mean, this is in general your full body health checkup. But that wasn't a concept then.
13 years, if you could recall 13 best moments, anything, 13 or 3, anything is fine.
Right from day one, I think 2013, uh, we've seen actually a lot during this phase, and you can actually say that Joseph and me have been playing multiple roles throughout this journey. uh, we've been the driver, we've been the collection guys, we've been we've been the courier guy, you know, every role that was there, the administration, the shipping, everything we have actually done hands on with during this time. So it's wonderful how you know, we have come to this stage now. In 2018, we actually launched our website, that is healthchecks360.com. We
Just 2 years
went
before the
digital.
COVID.
Yeah, and luckily so. I mean, it was when the market was struck with the health requirement. I mean, we were already there. So when in 2013, when we started, we were only doing B2B. We only reached out to doctors and clinics who had this understanding of preventive health screening, and they wanted to offer that to their customers. But 2018, we thought we'll shift to a B2C model where we directly reach out to customers. So the gap that we saw after you know, the health platform happened was the missing element. There was the customer care.
Oh, okay.
Okay, and when we kept customer care as the first priority in the whole journey, it changed the way the experience changed. Today we have customers coming back to us, and they're not coming back because of any campaign or any discount. They're coming back because they know what they are getting from us.
Okay.
When we brought in the platform, we brought transparency, accessibility, affordability, and we've got a network of clinics around Dubai, Abu Dhabi, and Ajman, Sharjah. That expansion, making things accessible to a nearest clinic near you. You could just go and do a health screening near you. We brought in transparency. We were the first actually who would display the prices of each and every test on the website.
Fantastic.
At that time, nobody was actually showing up the prices, you know,
Yeah.
up there. And you need to call a clinic to know the test prices.
Yeah.
So that thing was removed. Also, we had when I talk about affordability, as I mentioned, like, you know, there were clinics that were having highly priced packages like 3,000 and 4,000. So we were the ones who brought in packages that were almost one third of that price.
Oh, okay.
So I'm
It's
proud
very
to say
reasonable.
that
Very
actually,
reasonable.
yes,
Yeah.
yes. And when you say that reasonable, actually people will question you, like, you know, affordability is there, but what about the quality?
Thanks to Google.
No, that's a genuine question. Like, when you bring in something that is one third the price, are you really maintaining the quality? And I can tell you, to date, we have uh, only worked with accredited laboratories, ISO accredited labs, CAP accredited. CAP is, you know, it's the highest top certification for laboratories, and we are working only with these kind of certified labs. So even if someone is paying less, they're actually getting a quality which is of the highest standard.
That means the well-researched, well-planned clinic it is. So that 13 years, you made the healthcare very affordable. People are valuing it. It's very nice journey it is.
Yes.
Are you proud of yourself?
Alhamdulillah, we all are.
Alhamdulillah.
Actually, one more thing I'll add on is the 4.9-star Google rating that we have. I mean, that's something that my entire team is proud of. And we all work for it. It's really hard work. As I said, we place customer as the main priority, and everything revolves around that main customer. How we can make him happy, what solves his problem. I mean, think in that direction. I mean, you really satisfy, you really uh, bring in that comfort to your customers. They're definitely going to come back to you.
Wow. So was this your dream, to give a affordable healthcare for the patients? Was this your dream? And are you seeing the dream is becoming reality?
Yes, of course. You see, there was a conviction that, obviously prevention, as I said, it came into my training, but even with my parents, I have seen that, as it's kind of a cultural thing that you want to give back to the society. And when you get something and you pass it on, it always gives you a sense of satisfaction and fulfillment. And when you ask me about dream coming true, we started in 2013 when there was preventive was nothing. There was no preventive care concept at all. And today you see the market has evolved so much. There are so many clinics and facilities, home care services and all that they are offering. Prevention has become so affordable actually that it has now makes us feel that that movement we started is now actually fulfilled. Like, the market is ready, people are ready, people have become more aware. So that gives you a sense of fulfillment and satisfaction, of course.
How did you guys manage or handle the time of COVID lockdown?
uh, yeah, it wasn't difficult at all because, as I said, we were already established. 2018 we were already there. So when COVID struck, and people didn't want to walk into clinics, we were already there online to
Hmm.
facilitate them what with their health needs.
You guys are ahead of time
We
actually.
were ahead of time, yes,
Yeah.
alhamdulillah.
Alhamdulillah.
And that really helped. That really helped. Uh, we had existing customer base, we had new referrals that came in through that time, and all went well.
Wow. Good.
That was the best phase actually for health care.
Exactly. For
Yes,
healthcare concern,
yes,
yes, it was
yes,
a
yes.
best phase. And I think after that only people got very concerned about health and all because
It changed.
mindset is changed.
Mindset has changed. Actually, the evolving of the preventive health concept happened after COVID. People became more aware of their health after COVID struck.
Yeah. After that, people started going for regular checkups. And
Right.
earlier, no, until you feel something, they never used to visit hospital. After
True.
now, at least people go to gym. People are spending time on healthcare, well-being, and all.
Right.
So yeah, so which is good sometimes. Yeah. So 13 years you completed. I know you already mentioned the services offered by Health Checks 360. If you could elaborate that on what are the services and how people can reach out to you guys, and so if you could tell us more about the services which you offered.
So, HealthChecks 360, as the name suggests, we started with health checkups.
Mm.
Okay, but the 360 is now what we are into. We are not just a laboratory who's offering blood test or, like, any diagnostic checkups like once those that you fall sick and you do. We moved on to preventive checkups, that is health checkup packages, regular screenings and all. And now we are heading towards something that is optimizing your health. And this is where I think the next big leap we are going to take is about changing the way you start taking care of your health. The question now is changing, like, am I sick, to am I feeling well, or am I
Oh,
as good as well as I can be, like, so we're trying to optimize, we're trying to bring in longevity into that. And apart from that, we also have radiology services,
okay.
we have MRI scans, CT scans, ultrasounds, and consultations, of course, different specialities, urologist, we have endocrinologist. So since we work with a network of clinics, we have everything that you would be looking for, and you could just reach out to us to know more about
How
clinics.
to? What are the ways to reach you guys?
All right.
What?
So we are accessible through our platform, through chat, through WhatsApp, email, call, all channels.
Only in Dubai or any other Emirates as well?
We are available in Dubai, Abu Dhabi, Sharjah, Ajman, and slowly expanding into the other northern Emirates as well.
Okay. Okay, now it's time to ask what's next? What's your vision now? And do you have any plans in pipeline that, in 2 years, I want to do something, we want to do something, we want to accomplish this target? Do you have anything in mind?
So we do have a project in line that's
Oh,
supposed to be coming in very soon, and it's called Velafi. Okay.
what does
I
that
won't
mean?
lie. Have you seen Expedia or Booking.com?
Mhm.
It gives you a common place where you could just look into your requirement. You get a comparison right there itself. You don't go to individual airlines, right?
Mm.
To make your booking. You just visit Make My Trip and you see all the
Yeah,
listings there, and you
yes.
can make your choice. That's kind of a coordination layer, we could
Mm-hmm.
say. And the second one, I would give a resemblance of Spotify.
Mm.
How does Spotify change your experience?
Of course, I
You
can use it anywhere.
you can use it anywhere. Music has
Music.
always been there,
Mm.
but it has made music so accessible.
Yes.
You just, whenever you need, you can just open it. It has made convenience, it has added convenience to it. So you could say it's something that is coming with a blend of these two experiences. It's going to combine the two experiences and give you a much better platform that's going to take care of your health, and it's
Wow.
going to be there with you in the entire health journey.
When can we expect this development at Health Checks 360?
It would be done soon. I would say maybe by the end of this year.
I'm sure this will be a next big thing in Dubai or UAE.
Yes, yes, inshallah.
Inshallah. Okay. How many people works with you?
We have a team of 25, yes,
Okay.
and we're working around customer care, the sales, taking care of inquiries, to delivering the results, to following up with them, everything.
Okay. Any plans of expanding your services to other countries because UAE is also promoting health tourism. So is there any
Yes,
plans?
health checks has also already started in India at the
Mm-hmm.
moment. We are operating in India, and yes, we've got good response from them. It's just been a couple of months we started there, and yes, slow steps, but yes, steadily we'll grow.
Fantastic. As a woman, and you achieved accomplished so much. How proud you are about yourself.
It's really wonderful. It's a wonderful journey. Throughout this time, I have learned so much from each and everyone who I've been associated with. Um, they've left something for me to learn from, and over the years, I have grown in knowledge and experience. And yes, I would always love to give back what I have learned.
Which part of Mumbai you are from? Actually, if I ask about childhood, you spent maximum time you spent during your childhood.
Yeah, South Mumbai.
South Mumbai.
Yeah,
Okay.
and I study from Navi Mumbai actually.
Navi Mumbai. Actually. Okay. If you go back to your journey of, I mean, if you go back, what the person current Dr. Naushin would tell to 18 years का नौशीन को क्या बात बोलना चाहोगी?
I think one thing that I have learned, and I would say, is being patient with your thoughts or with your plans. You know, like if I have to go back and uh, look at the journey of Health Checks 360, when we started, there was, I mean, we didn't have any support. We didn't have, the market wasn't ready, and we didn't know whether this would work, but we were patient. The 5 years that we spent with patients, I mean, is that what is paying off you? So I think the advice that I would give myself, to the 18-year-old myself, would be to be patient with your plans and work towards it in the right direction, not to give up anytime.
Have you ever felt that, मुझसे नहीं होगा, बस I'm failed, मुझे नहीं होगा? Have you ever felt that? Has that thought came to your mind?
No,
Ever?
I'll tell you, I'm actually a solution finder, so I don't really, crib much on the problems. So whenever there is a problem, it's just for a minute. I just need little time to process what's the problem exactly, and that's it. Then I don't talk it as a problem. Then the next step is what could be the solution to it. So I don't write, nahi hoga kind of. It doesn't
Positive
really-
mindset. Has anyone inspired you to have this kind of positive mindset? Because very rarely people have positive mindset. I mean, nowadays, because people overthink too much. So, but I appreciate the people who still carry the positive mindset and are moving forward with that attitude.
Yeah, I actually have learned this in childhood itself. Like, I believe in being positive. There's lots that people can think negatively and, drop themselves down. But your own self can only lift you up, I believe. And staying positive is the only thing that can keep you charged up. कोई external party cannot just come and motivate you unless you want to be motivated. So I feel that being positive from inside is the most important.
Do you talk to
thing.
yourself
No, not now.
earlier?
Yeah.
Because now the talking to ourselves called as a manifestation. The more good things you tell about yourself, it will charge you up. It will motivate you more. So I asked, do you talk to yourself?
I used to, and I always used to talk positive. Now I teach that to my kids.
Are
I don't have to do it much, mind, because now it's become kind of a habit that you're positive, you're thinking only good. But now I teach that to my children to be positive.
Health Check 360 completed 13 years. Congratulations once again.
Thank
If
you.
anything you want to say to our audience, now it's the time.
Firstly, I'd like to thank everyone. It's been a wonderful 13 years of support that I have got from everyone around me, though being a Joseph for having this conviction and this concept, the regulators, DHA, for having supported us. They've created such a wonderful healthcare ecosystem here, that businesses like us can come up and really work through for the society. Then my team, they've been really working hard, and they've considered this business as their own. It's not like a job for them. Our patients, our customers, thank you for trusting us with your health. And yes, inshallah, we are working towards making your experiences even more better, and we'd love to see the same support and from you all. And we promise to deliver the same care and with the full same commitment to taking care of you.
Thank you, Dr. Naushin, CEO of Health Checks 360. Thank you so much for spending your time, sharing your vision, ideas, and journey, the 13 years journey of Health Checks 360. Thank you so much, and hope to see you soon, along with the new ideas, new vision, a new platform.
Thank you so much for having me here today. It's been wonderful speaking to you. Thank you.